FA Well Centers, welcome. I'm going to talk today about breast cancer risks, about whether you should get a mammogram, what the alternatives are to it, and things that you can do today to prevent your risk of breast cancer. I love this thought of who's going to get breast cancer and who's not. And most people, they look at it and they say, oh my gosh, I've got breast cancer genetics. I did this BRCA gene and whatever it is, and I am destined to get breast cancer. Well, I'm here to tell you it doesn't have to happen. Just like any condition out there, we are going to think about gene expression. And this is something that we're going to get into today and let you know exactly what the risk factors are for breast cancer and what you can do to prevent this from taking place. So welcome everybody. Pop down below where you guys are watching from. And if you've got a family history of breast cancer, if you've had a scary mammogram, if you've had lumps, if you've had fibrous tissues, anything at all like that, and what you're doing about it. Do you get a mammogram or do you not? This is something that is a very big conversation. Do you like to do a thermogram where you do that temperature scan? What are you doing for yourself? This is a great resource. We've got amazing people that watch these videos and follow this page. So pop down below, start a conversation, help inspire somebody to get their life back. So welcome everybody. Let's jump into it. Breast cancer is rampant. We hear about it all the time. I guarantee you know somebody that was 38 or 42 or 45 that ended up getting breast cancer, that beat it, or they died, or they had to have their breast removed. All these different things. It is everywhere, and we're seeing this this type of cancer go up. And there's specific risk factors that lead to this. Certain things that we look at that we say, you know what? What are some of the things that we can control? What are some of the things that we can actually prevent? Because here's the deal. Unfortunately, cancer research has been a bomb. It has not worked at all. They've spent literally billions and billions and billions of dollars on cancer research, and it has failed miserably. There's many people that have been in the cancer research world that have given up. For years, they thought it was a genetic thing, but in reality, what they found is that cancer is a metabolic condition, meaning that it is driven by an altered metabolic state. So the worse your blood sugar is, the worse your inflammation is, the worse your body its overall state is, the more likely you're going to be to have cancer. So the best cancer treatment is cancer prevention, because cancer treatment is a crapshoot. Whether you throw those dice and you do chemo, radiation, you go down to Mexico and do alternative treatments, whatever it is, nobody really knows. And if cancer research and it was just about money and we had all this stuff figured out, Steve Jobs would still be alive. Steve Jobs had pancreatic cancer and he still died. He had all the resources in the world. He could have spent unlimited amount of money on fixing his cancer and not dying, and he still died. And so the best treatment is prevention. And of all conditions out there, it's way better for my mom. I wish I could have prevented her MS. For my wife, I wish I could have prevented her thrombocytopenia and they didn't take out her spleen. I wish I could have prevented those things, but you can actually treat them. And now my mom doesn't have MS, and now my wife works out 6 days a week and had 4 boys, it's 9+ pound babies and all these things, and they were able to get over that. But cancer, and for some people, especially if you die, there is no getting over this. So this is really where we've got to get into risk factors and then things you can do to prevent that. So again, pop down below where you guys are watching from. Love to see you. We'll give you a shout out there as well. And what you guys are doing, what you're thinking about, is this a big worry? Is this something that you have a lot of fears about? Or you're like, you know what, I'm just doing everything I can every day to be as healthy as possible and prevent this from happening. So here's some of the risk factors for breast cancer. One of the big ones that a lot of people don't think about is research is showing that if you've been on birth control, remember, birth control is not hormone suppression. You're not just suppressing your hormones and going, oh, I'm not going to menstruate. Christy, great question. We're going to get to that in a second. whether you suppress your hormones, that's not birth control. It's actually hormone replacement therapy. So you're getting estrogens, you're getting hormones in there. And the research shows the longer somebody's on birth control, the higher percentage of breast cancer risk. If you're on other types of hormone replacement, if you're taking estrogens, if you're taking other hormones, you are going to increase your risk for breast cancer. We know genetics do play a role in this. If grandma had breast cancer and mom had breast cancer and aunt had breast cancer, so those things, you better work your butt off to not get breast cancer. And you better work your butt off to do the things that are going to make sure your body is eliminating these estrogens, all these different things. Here's another risk factor is a female that starts menstruating early, like under 12, or menstruates late until they're 55 plus, and their menopause is that late. The longer that somebody goes through a menstrual cycle and has these regular menstrual cycles, the longer, the higher risk of getting breast cancer or other estrogen-based cancers. So basically, you're exposed to estrogenic events, these menstrual cycles, for longer. And that's why they say women that have more babies and go through that birthing process, because you're not menstruating for 9 months plus however long until you start menstruating again after having that baby. So the more babies you have, in theory, the lower percentage risk of getting breast cancer. Same thing with breastfeeding. And so if you have one kid, but you breastfeed for 3 years, or you have 4 kids and you breastfeed for 3 years total, it's going to be the amount of breastfeeding is going to be equal on there. So breastfeeding as long as possible is actually going to decrease the risk of breast cancer. It's good for your child, good for that immune system, good for the connection, all those different things. Yes, so Rebecca, what about years of nursing? Exactly. I have like 5 years worth. So that's great, because that's, in theory, you probably weren't menstruating while you were breastfeeding on there. So I'll get to some of these questions here in a little bit, guys, but yeah, keep asking questions, and I'll get to those. So the longer amount of menses from early to late, and not having babies and not breastfeeding, those are all big risk factors. Being overweight, if you're overweight, you have a higher risk of breast cancer. If you smoke, you have a higher risk of breast cancer. If you consume alcohol more than a drink or two a night, you have a higher risk of breast cancer. If you've had chest radiation, any type of CAT scans, any type of x-rays, excess x-rays, things like that, higher risk of breast cancer. If you don't exercise on a regular basis, not just going for a walk here and there, but actually doing exercise is a big part of it as well. And keeping that blood sugar as steady as possible. If you are pre-diabetic, diabetic, metabolic syndrome, remember, cancer is a metabolic disease, and you need to do everything you can to keep that metabolic state neutral, to keep that blood sugar as steady as possible, everything you can through there. So those are all the risk factors. So what can you do? What can you do today to make sure that you don't go down that path of getting breast cancer? Well, one of the first things, if you think about exposure to estrogen, one, you don't want to be on birth control. You don't want to be on hormone replacement therapy, be on these hormones. You want to figure out, most women that I see, they went on birth control not for preventing birth, but because their hormones were jacked up in the first place, and they were having acne, and they were having mood swings and all these other things. So you've got to get your hormones figured out first, and then prevent going on these hormone replacement therapies. Or if you're on those, you've got to fix the underlying imbalances and then get off of those hormone replacements. So that's one of the basic things, is to not bring in more estrogens, more hormones into the body. You've got to look at plastics. Are you microwaving in plastics, cooking in plastics, eating out of plastics? There's drinking out of plastic water bottles. There's a lot of places. If you do a quick Google search of where am I getting external estrogens, what type of plastics have estrogens, things like that, you will find that information and stop doing some of those things. So one, stop the estrogens from coming in, but two, you've got to make sure that you're eliminating these and that you're getting rid of those estrogens. So what does that mean? Well, start with the liver. We've got to make sure that the liver is detoxifying and it's processing processing out the hormones. This is something we do with every one of our patients, is we've got to make sure they're going to eliminate those hormones like you need, because somebody could not be bringing in a whole lot. Like, okay, oh my gosh, I don't use plastics, I don't take hormones, I don't do all of these different things that create more estrogen in the body, but they're not eliminating, they're not getting rid of it. So you've got to clear it out of the liver. But then here's the second stage of that detoxification, is in the gut. So that liver packages up the hormone that needs to be excreted. But in the gut, if you have a microbiome imbalance, if your gut is out of balance, it opens it up, it unpackages it, you reabsorb it back into your tissue, and then you've got that estrogen floating around in. So you've got to make sure your liver's detoxifying, you got to make sure your gut is working like it's supposed to, and then ultimately get down to inflammation and excess body weight, especially adipose fat tissue, because we store toxins, we store estrogens, we store hormones in our fat cells. And so if you have excess fat cells in your body, you're going to be holding on to more hormones, you're going to be holding on to more estrogens. That's why it is very, very important to try to get as close to your ideal body weight as possible. Not maybe what you're wanting your ideal body, but what your body is very comfortable at, and a good, for most females in that 20 to 25% body fat range isn't too bad. When you get down in the 15%, then you're probably getting a little bit low. But for most women, around that 20% is not a bad number to be at. So you've got to make sure that you're not holding on to those as well. Let me jump through some of these questions here. Looks like we've got a bunch. So Chrissy asked, mammograms or thermography? So a mammogram is where they take the machine, they smush down on the breast tissue, do a mild little scan X-ray of that breast tissue, looking for any type of dense spots, anything like that. And a thermography is going to be this picture where we are going to get a thermal image. So you stand there in an office, and no shirt, no bra, anything like that, and they do a thermal imaging, and they're looking for hot spots. And in the research, they show even 6 or 7 years before a mammogram will show some type of breast cancer issue, the thermography can pick up hot spots, and that cancer creates more heat because of that. So, hey Stephanie, good to see you in Georgia. Tama, a year before I was diagnosed with breast cancer, my lump was detected by a CAT scan. Yep, and so Tama, I wouldn't be surprised if you were doing thermography. You might have been able to pick that up even 5 years before that. Kristen, I had a preventative double mastectomy 3 years ago. Check 2 gene. I worry about my 3 daughters now, all early onset menstruation, as well as genetics. So, Kristen, you better make sure that those girls are detoxifying like they need to, that they are, that their bodies are clearing out these hormones, that they're not taking birth control, that they're not bringing in excess estrogen, and they're able to kick it out as much as possible. What about nursing? Like 5 years worth? Yeah, Rebecca. So again, the longer you nurse, the less exposure your body has to estrogen. Tama, I was diagnosed with ER positive at 95%. I questioned it years ago because my hormones were out of whack, never ever got a straight answer. Yeah, unfortunately, once you start getting into hormones, does sugar raise estrogen levels? So, sugar in general. So if you eat sugar, it doesn't make your estrogen level go up. But if your blood sugar is jacked, if you're out of balance metabolically, yes, you are going to hold on to more estrogen. You're going to hold on to more body fat. It's going to sit in those tissues. So yes, ultimately, if you eat a lot of sugar, it will do that. Stacy, MTHFR gene not being able to detox bad estrogens too. So MTHFR, doesn't necessarily go down that path. I've seen tons of patients with MTHFR gene, and they never have breast cancer issues, anything like that. But not being able to detox bad estrogens, you better put everything you can into making sure that you're getting rid of those estrogens. I got my first mammogram 8 months ago. They want me to do this every 6 months because my breast tissue is dense. I would look into a thermogram as well. If you want to keep getting the mammograms, that's fine. But I would look into locally to get a thermogram. And what about Marina? Yes, the hormones in there as well. Estrogen is very high during pregnancy, so that doesn't make sense. Here's the deal. We're talking about it's a different type of estrogen. Those estrogens are going to specific places, and we're not getting it that is potentially going to be um, leading to those breast cancers. What about postmenopause? No uterus, ovaries. What about taking progesterone? So progesterone is going down a different pathway than estrogen. So progesterone will not turn into estrogen. So you don't have to worry about that. That's not going to be part of the issue. Lou and Sandy, no one knows the cause or the cure. Well, for an individual person, sure, nobody knows what that one cause was. But here's the deal: there is no one cause. We know what causes cancer. I just went off a list of 15 different things that can cause cancer. So we know what can do that. Could somebody do all these things perfect and still get cancer or still get breast cancer? Yes, unfortunately, just following every recommendation, do everything perfect, you can still get exposed at work. You can still get other issues that are going to contribute to getting breast cancer. But we know what causes it, and we know that if we fixed a lot of these things, overall for everybody, the percentages would go down. The cure, absolutely. No one knows a cure. There is no cure there. Tim, I have very dense breasts as well. I get my mammogram and breast MRI, one of them 6 months, and the other the second 6 months. Yeah, so I would look into the thermogram as well. And and that's one of the concerns. I don't know if radiation from mammograms can actually cause that breast cancer. I know that there's research showing that people that have more mammograms have higher rates of breast cancer. Is that because they're dense breasts and they're telling people go get more breast mammograms because we're concerned about breast cancer, and they're going to get breast cancer anyways? Not sure, but there is a certain amount of radiation that comes out of the mammograms. Yeah, I mean, every 6 months seems like it was almost too much to get that done. We do not do thermography. If you're in northern Colorado, I know of a lady that can do thermography. But otherwise, if you just do a quick Google search for wherever you live, there are people all over the country that are doing it. All right. So is thermography more recommended than mammograms? Correct. So here's the deal. It's going to get us different information. So the mammogram is going to, again, do the little radiation, squish the breast tissue. If you have very small breast tissue, it's not much fun. It's uncomfortable. If you have really large breast tissue, you're only going to see so much in a mammogram. That's where the thermogram, I think even if you are getting mammograms every year, 2 years, 3 years, whatever your recommended cycle is, I would still look into the thermography, and get some answers there. You can see lymphatic congestion, a lot of different things as well in there. All right. And Stacy, again, we do not do thermography here ourselves. If you're in northern Colorado or southern Wyoming, we can get you the name of somebody to do that. But otherwise, just Google your local area wherever you are in the country, and we'll go from there. So, all right, guys, this is something that obviously it's a hot button topic, being a female and knowing people that have had breast cancer, probably died from breast cancer, and so again, it's just like anything. Don't bring estrogens in. Don't bring these excess in that are going to lead to cancer, and make sure that you're eliminating it. And that's what it comes down to. You can't just take the magic herb. You can't just go, I'm not going to eat out of plastics or drink out of plastic water bottles or whatever it is. You've got to do a whole body approach, and that's just like anything in health. You've got to look at every system and everything you can do day in and day out. What can you do to be the best you possible? So stay strong out there, guys. If you have any questions at all, let us know. Take care.